Hello, everyone. This
Hi,
is
everyone.
Brandi Murphy and Dr. Deedra Mason. I'm the director of nutraMetrix, and Dr. Mason is the director of clinical research and education for our health professional division with nutraMetrix and Market America. And we want to welcome you to our meet on today. The reason why we decided to do this meet on is, both of us have been asked a lot over the years why we chose to partner with nutraMetrix, both myself as a nutraMetrix consultant and Dr. Mason as a health professional. So we wanted to take the opportunity to discuss some of our favorite aspects of nutraMetrix, why we personally chose to partner with nutraMetrix, and then we're going to open it up for a question and answer session with uh, all of our attendees and all of our viewers. So why don't we go ahead and get started? Dr. Mason, why don't you start telling them about how you got started with nutraMetrix, what your favorite aspects of nutraMetrix are, and why you chose nutraMetrix over some of the other product lines that were available to you.
Okay. Well, for those of you that have looked at the nutraMetrix line, you know that there's a large diversity in the line. There are a lot of different products that I can use clinically in my office with my patients practicing primary medicine. Now, this is something that's true for a lot of professional channel companies out there. They're really focusing on the types of patients that we're seeing in medical offices. So in any nutrition line or supplement line, when a physician is looking at it, they need something that's going to give them either a cutting edge support for their patients. That may mean choosing something with cutting edge ingredients or the right formulations. And the truth is, nutraMetrix offered me both of those things. I was able to get very comprehensive formulas, but I was also able to find formulas that had the right ingredients with the right supporting botanicals, minerals, or cofactors. But something that really set nutraMetrix apart was the idea of an isotonic delivery system. When you're looking at a product line, you want to make sure that a couple of different things are available to your patients, ultimately to support who you are as a clinician. That may be producing results. The only way I'm really going to keep my patients compliant and well in between office visits is if they're going to uh, if they're going to see results from the products that they're using. So at the end of the day, I can recommend a calcium, a magnesium, a multivitamin, an omega-3 fatty acid. But if on follow-up with my patient, they can't tell me that they feel better, that they've noticed an improvement in their health, or I can't show them a tangible improvement, maybe through lab work or uh, uh, survey type questions that elucidate or give us an opportunity to say, are you better, worse, the same? If at the end of the day they can't tell me that they are, then they're one, not going to stay on that product, and I haven't really met any clinical goals with that patient. So the primary factor is whether or not a formula will produce results. And that's what we noticed with the nutraMetrix product line, is that it produced results for our patients. And it did it with a higher quality supplement than my patients were taking from over the counter or were even getting from some of their other complementary and alternative practitioners. Because in an isotonic delivery system, which is one of the product lines made available by nutraMetrix, I was able to give my patients a product that had no fillers and binders, didn't have any of the allergens that can be a concern in a patient, and I also had the ability to formulate that in a custom blend or a custom cocktail for my patients. So if I needed them to get more of an antioxidant or a specific antioxidant, something to help keep blood sugars in healthy ranges and give them the energy throughout the day, I was able to formulate through custom cocktail for them. These are the types of things that no other professional channel had offered to us in our industry. And so it also gave me kind of an edge or a cut above some of the other practitioners that I was working with or that I was in network with. I had something new to offer my patients. I had something that would produce results for my patients, and I had something that would meet my needs for quality, a product with no fillers and binders, hypoallergenic, and using the right forms of ingredients that were supported with other nutrients in the formula. I would say that there's something else that was really important to me with nutraMetrix, and it was having the contact with a consultant to help me with the practice. It was having knowing that my voice as a clinician was being heard by the company. Because nutraMetrix utilizes a product brokerage system, we only work with experts in their field in the formulation of omega-3 fatty acids, multivitamins, or digestive support products, as an example. And so knowing again that I was working with a company that was moving out into manufacturers that were experts at what they did, and then we were able to brand those based on the company's desire for formulas. That was something huge. I mean, at the end of the day, when you look at another product company, if they're making their formulas, then they have a vested interest, a financial interest in sticking to the formulas that they've developed. When you're working with a product brokerage company that is using contract manufacturers, the company can then set their standards for what they expect in a formula and have it delivered from that manufacturer. And that gives us kind of the bob and weave aspect in medicine. We know that as new science comes out, we're going to want to support our patients' needs, and that means being able to change the formula based on what is showing to be relevant in clinical nutrition today. And that's just an aspect that many companies won't have if they're stuck to making their own formulas and can't contract that formula with an expert. So that was something that I would say was the wow factor for me and nutraMetrix, was knowing that we had that kind of flexibility or dynamic approach to patient care.
You know, you pretty much described me as one of those patients when you were talking about if a patient's not going to be compliant because they're not seeing results.
Mm-hmm.
When I started with nutraMetrix, it was really, actually I started with the parent company of nutraMetrix, Market America, prior to the nutraMetrix division being created in 2006. And I started as a customer of the company first. The reason why I started with the company is, I had a lot of health challenges personally over the past, I'd say 10, 15 years. And I had a lot of health challenges that my health professionals were struggling with helping me get improvements on. So traditional treatments weren't working. The traditional medications weren't helping me feel better. And so I started turning to supplementation as a last resort to try to feel better. And I was one of those people that would go into GNC or Vitamin Shop or one of those mega vitamin stores, and I would spend $400 to $600 a month just trying to feel better, grabbing anything that I thought might help me, with no knowledge of whether those products were going to be interacting with the medications that I was on, whether those products had what I needed in the proper amounts in it or not. So despite the fact of spending $400 to $600 a month on products, I really wasn't feeling any better. So I did stay on products for a while from other companies, and then because I wasn't getting the results I want, I kind of decided I was going to give up on nutraceuticals, that supplements weren't going to work for me. And I'd go back to my health professionals and say, I still don't feel well, what can I do? And they didn't know. They didn't know how to help me. And it wasn't until I came across a health professional that had experience with Market America's isotonics line that they were using the isotonic line with one of my friends. And when my friend got some really great results with the isotonics products, they recommended them to me. I started trying those products in a short period of time. I started noticing results because the comprehensive formulas, the better bioavailability, the enhanced absorption. Finally, a product that I was taking worked for me. So I was able to cut back from the $400 to $600 a month in products that I was taking to under $100 a month and feel incredibly different. I really noticed those results. So then when the nutraMetrix line came about, I'd already been a distributor for about a year and a half. And when the company talked about creating a line exclusively for health professionals and then providing the support and the education to health professionals, that was a perfect fit for me, because once I had been through the health challenges that I had been through and gotten results, I became passionate about sharing that type of information with others. So I love the fact that nutraMetrix has a mission of helping to educate health professionals on the use of nutraceuticals and clinical nutrition and lifestyle interventions into the traditional treatment plan. And by doing that, by having a mission of helping health professionals understand how to incorporate nutrition into their practice while helping the practitioner learn how to implement the programs into their practice and generate additional revenue for the practitioner. That was a home run for me. I really love that.
Right, and you bring up something that's so important, which is this idea, this concept of spending hundreds of dollars a month on supplementation and then using supplementation as a last resort. You know, that's not uncommon in our patients or in our community, that they'll be spending a great deal of money on products, and that's something that's so important as a nutrimetrics, not just health professional, but someone that works with the field to help practitioners understand the importance of nutrimetrics or utilizing a wellness medicinary within the practice because of its ability to generate income. You know, the question has never really been, as you just mentioned, the question has never really been whether or not patients are willing to spend money on supplementation. The truth is they are spending money on supplementation, and we have a way with nutrimetrics to kind of recapture those wellness dollars, make sure they're spent within the facility's practice, and then put back in the hands of the practitioner to be discriminating about what their patient is taking, in what amounts are they taking, and what combinations are they taking these things. And you know, from the traditional standpoint, or I'll say the conventional standpoint of medicine, some of our practitioners are no better educated than the community about interactions or about the importance of supplementation. And that's why I thought it was interesting that you said as a last resort, when at the end of the day, if we used simple things, simple interventions like a multivitamin, an antioxidant, vitamin D and B vitamins, an omega-3 fatty acid on a daily basis. You know, many of the concerns or chronic life factors or quality of life factors or chronic disease factors really would not have they wouldn't be it wouldn't be the toll that we see in medicine today if we were teaching some of those fundamentals. And that's something that I think is important to me, that's very close to me because, one, I'm a geek. Two, I love science and I love the clinical aspects that nutrimetrics brought to our practice from an education model. You know, while no fillers and binders was a big deal to us, while quality of products was a big deal to us at the Integrative Center, and while producing results or having better clinical outcomes was really important, something else that really made the difference to us in opening our account with nutrimetrics was knowing that there was education in place, whether it was for my patients with different materials that were made available by the company, whether it was weight management solutions that made it available in an online form for my patients to have both accountability and community when it came to losing weight, and knowing that they were supported on a daily basis. Yet that didn't require more face-to-face time with me or my staff, which meant I was leveraging myself, our clinic, and then of course our patients by utilizing that online community. And then we have what's referred to as the NEI, or the nutrimetrics Educational Institute. This is a CME course that is done annually from nutrimetrics, or rather from a nonprofit called the NEI, sponsored by nutrimetrics, that gives practitioners that don't have that expert knowledge about clinical interventions or nutritional interventions or non-medical interventions as a first-line therapy. And so I really feel like, and you mentioned a home run, you know, I really feel that nutrimetrics set out to find a better way to educate patients, to educate practitioners, and to assist to assist all of us in being able to be healthier, to really know what it is that we would be able to do on a daily basis to support our needs. And from a clinician standpoint, the education model was a huge aspect, and definitely, I would use your word, a home run.
Well, what I found for me is after I had transformed my health by incorporating the lifestyle changes and incorporating nutraceuticals into my own regimen by working with this one health professional, when I'd go to my other health professionals, they would tell me, oh, it can't be that. It
Right.
can't be those products. It can't be the way that you've changed your eating. It must be the medications now working, or it must be something else. And so I found that there was really a need for education, especially in traditionally trained doctors. There was a need for them to understand lifestyle management. When I was going through all of my health challenges, nobody ever once asked me what I was eating. Nobody ever once asked me how I was sleeping. Nobody ever once asked me what I was doing to deal with stress management. And I had a lot of compounding lifestyle factors: poor diet, lack of sleep, high stress environment, that were contributing to some of my health challenges. They just weren't being addressed. So when I had the opportunity to become a nutraMetrix consultant and get trained on working with health professionals to help share that information with them, and to partner them with resources like Dr. Mason and our clinical faculty for the NEI, and other successful health professionals who had significant experience in using nutraceuticals and lifestyle interventions in their practice, it's so rewarding for me to be able to see that health professional who doesn't have a lot of experience with nutraceuticals start to see changes in their patients. And with each change that they see in their patients, with the results that they get with the patients that they try products with or lifestyle interventions with, all of a sudden you start to see a shift in their thinking and they start to embrace wellness. One of my favorite things about nutraMetrix is that I've been able to help practices who were very traditionally allopathic practices transform into wellness-based practices, where now they start with a first-line approach with
Right.
nutraceuticals. And in addition to having better patient compliance and better patient outcomes, they get more referrals from their patients because their patients get better and their patients feel great. They have more energy, so they send more patients to that office. So as they have more patients coming in and the nutraMetrix program is generating additional income for the practice, then you start to see the practice be able to have more options on how they want to practice medicine. And that's very rewarding for me to be able to be a part of that. So I love the nutraMetrix program for that reason.
Yeah, and I want to just kind of capitalize on that, because that really is a very neat feeling as a clinician, to know that you have helped one of your patients, that you've done something for them, as something that they haven't received in the past. Brandi, you brought up kind of quality of life factors, better sleep, mood, those sorts of things. You know, there isn't, it doesn't need to be a replacement of a medical model to utilize nutraceuticals, weight management systems in a practice. In fact, it only adds to kind of the menu of services that you can offer your patients, because while you practice primary medicine, you have the ability with a nutraceutical line with nutraMetrix to be able to meet those needs that the standard medical approach or pharmaceutical approach isn't meeting, like better sleep and that better mood, more energy throughout the day, less joint discomfort. And these are very much the types of things that patients turn around and say, my doctor, this is what they did for me. You need to see my doctor. And
So true.
that is something that is really puts a smile on a physician's face, because they know that they've made an impact, and it has been something in the past that they've had no access to, that they've had to say to themselves, I don't know how to help you with that. And now there's an option for that. It's really, really quite exciting to see that transformation in the conventional physician into a wellness-minded physician. I love it. Yeah.
One of the other parts that I love, you mentioned the NEI course. We have one coming up in less than 2 weeks in New Orleans. And we are, one of the things I love about the courses that we have in nutraMetrix, whether it be the NEI course, which is the CME-based course, or whether it's a nutraMetrix sponsored course of our our product and implementation training that we offer. What I love is seeing health professionals of all different backgrounds, of all different types, whether it be an MD, an acupuncturist, a physical therapist, a chiropractor, all different models, all different backgrounds, all different levels of experience, all different belief systems when it comes to nutraceuticals. They come together and they learn from each other. And so within nutraMetrix, we've created quite the community of wellness-minded individuals that not only learn from nutraMetrix, but learn from each other, and nutraMetrix learns from them. And so it's become quite an integrative community that I think is fantastic, and we don't really see that anywhere else. We get a lot of feedback from the health professionals that attend our courses or attend our Facebook group and meet on sessions that they love learning from each other. So that's another thing that I just like to point out as one of my favorite aspects of nutraMetrix.
Right. We could all use a better community, a better connected community, and that's the kind of momentum that you get caught up in when you transform a practice. And like I said, nutraMetrix set out to find a better way to do that, to give patients and physicians an option towards better care. That was the mission, and I believe that that's exactly what we did.
Mm-hmm. Yeah. I agree. The last thing that I'd just like to comment on before we open it up for questions is the role of the nutraMetrix consultant. You know, you're a health professional, I'm a nutraMetrix consultant. Part of my role in being a nutraMetrix consultant for the practice is to help provide the support for the health professional who may be new at implementing wellness programs in their practice, to give them the resources, to give them the support, to help them to sit down and identify how the practice's vision can be supported by implementing wellness programs, how nutraMetrix can support the mission and vision of an existing practice, how we can create an implementation for the implementation model for the practice that's seamless, so it doesn't put a lot of extra work on the staff, that the staff knows what to do with the patients know where to get the products, and that the MC can really help to develop that implementation strategy for the practice so that the practice doesn't have to create the wheel all over again.
Right.
Can you just mention quickly how your MC was able to help you kind of get set up? Because you're a little bit different in that you were using nutraceuticals in your practice for a long time before nutraMetrix.
Right.
But just speak for a second on the role of the NC, both for an experienced practitioner versus a brand new practitioner when it comes to implementing wellness programs.
You know, my nutraMetrix consultant did something that, in my opinion, was so brilliant. She went right to the core and said, you know a lot about medicine, but you don't know a lot about business, and you need to be focused on building your business in the sense of increasing patient referrals, increasing exposure of these educational models, or the importance of supplementation on a daily or regular basis to the patients. She was fantastic at helping me identify that there needed to be tools that were implemented in the practice that would enhance patient flow or office flow within the practice, so that there was a natural mechanism of exposing patients to nutraceuticals, weight management options, even genetic analysis to support their needs and to get some of their questions answered. A way to measure whether or not we were being effective in not just patient care, but in customer satisfaction, patient satisfaction. And so she did a great thing by, again, just exposing to me that while I may know something about the clinical physical diagnosis or pathophysiology, what I really needed to focus on to be successful and practice the kind of medicine I wanted to practice would be some of the marketing aspects of nutraMetrix, some of the support tools or resources that were made available to me that maybe I wasn't utilizing, that would enhance patient compliance, that would enhance patient follow-up, that would enhance patient referrals. And it was really the business aspect that was very impactful for me. But I don't think that, open up a box type of marketing program ever could have done this, because she was a soldier, in the field. She was on the ground in my office and could look at my office and say, product displays would be effective here. If patients are coming in and they're spending time in this room, don't make them wait in this room. Generate income in this room by showing off some of the education that we have, or maybe putting in a survey that asks questions about what can we do better for you. I mean, my nutraMetrix consultant was absolutely essential to the success of my program, because time and the time it takes to implement was something that was a concern for us. Were we going to have time to do this? Was it going to take time away from my staff? And so she was able to show me places that maybe there were already choke points or stagnation in the office flow, where we could really maximize a conversation about nutraMetrix and staying healthy in between office visits. So that was a big deal.
Great. Well, I see that we have several people on the line, and I recognize some of the names. Some of them are health professionals, and some of them are nutrimetrics consultants. So what I'd like to do now is open up the floor to some questions. If you guys have questions for either Dr. Mason or myself or both of us, please go ahead and type in your questions into the box, and we will go through and answer your questions. And we'll stay on for a little bit and see if we can answer questions for you. So all you have to do is in your little text box there, just type your questions in, and we can see them, and we'll try to repeat the questions so that you guys know what everybody else has answered. Does anybody have any questions for us today? Great question. The first one is there a number of products that you would like to open a practice with? And that's an excellent question. One of the things that I would say is you don't want to overwhelm a practice too quickly. The first phase of implementation, and we teach this in the nutrimetrics consultant training, the first phase is to select a small grouping of products that health professional and the staff can get comfortable with. And you're going to develop an implementation plan around those products. So I would select maybe 3 or 4 maximum as the number of products that you're going to start with in that practice. You're going to train the health professional on those 3 to 4 products. You're going to train the staff on how to support the health professional in the movement of those products through the practice. And then once the implementation plan is in place, it's very easy to add more products. You can add a new product a week, or you can add a new product a month, whatever their comfort level is going to be. But we do find that if health professionals start with too many products too quickly, they get a little overwhelmed and sometimes might suffer from what we call paralysis by analysis.
Right.
And if they feel overwhelmed, they might not move forward. So I would say keep the number small to 3 or 4 products, with the exception of if you're working with a practitioner who's been using nutraceuticals in practice for 20 years and they already have an implementation plan in place that's worked for them, they already know how to use products in their practice, then you might start them with more. But for the average practice that's just getting started, I'd say 3 to 4 products.
And you mentioned something I thought was important, which is if you're working with a clinician that feels comfortable with a product line, they feel comfortable with utilizing nutraceuticals as part of their treatment or care options, you're going to have the opportunity to fill in gaps where they have not yet found a product that has met their needs. This is often an isotonic delivery because many patients don't like to swallow pills or don't like the multiple dosing of some formulas where you take several pills several times a day. Compliance isn't high. Ease of use with that type of model isn't great with the patients. And so if you're working with a clinician that has a lot of experience, you just may want to focus on where they haven't found a solution yet for their patients and see if it's something that nutrimetrics can offer them.
We have another question about if the nutrimetrics program has gone international yet. And that's something that we're working on in 2013 for the nutrimetrics division, to take the model that we have internationally, because Market America, our parent company, is a very global company and they're available pretty much anywhere right now.
Right.
But we're working on first developing a support system in the countries that we are open for Market America with. We have Taiwan, we have Hong Kong, we have Australia, we have Canada, we have the UK, we now have several South American countries and several European countries that we're working with. And what we're starting to do is develop systems, because each country's medical system is different, and we need to make sure that the nutrimetrics program will work in each of those countries. But it is our goal in 2013 to put an international plan for nutrimetrics in place, and we've already been working on that. So you'll find out more about the international expansion of nutrimetrics at our convention in August, where we will have very close launch dates available for you at that time. But as of right now, the nutrimetrics program is only available in the United States. Now there's another question there that I think is great. How does a common person like myself approach a doctor if I don't go to the doctor myself very often? And that's really where I started. When I started with nutrimetrics, I was at the time a middle school teacher. I didn't have a lot of sales and marketing background. I didn't know how to go out and approach a health professional, and that's where the nutrimetrics training really came in. The nutrimetrics training teaches how to approach health professionals, how to talk in themes with health professionals about the need for patients to be on supplementation, how to choose good quality supplementation, how to get appointments with the staff, who on the staff should you meet with. So my answer to you when you're saying how do you get started is I would try to plug into the nutrametrics training as soon as you can so that you learn how to approach the health professional. Because one of the things that I find is everybody knows a health professional that can benefit from nutrametrics, but not everybody knows how to get started working with them.
Right.
So the nutrametrics consultant training is really your introduction course. It's a 3-day course about how to get started working with health professionals. And then once you come back from the course, you're not on your own. We have weekly training webinars that Lauren Sauerbeck, our Director of Sales and Field Development for nutrametrics, hosts. We have 9 now regional field consultants that also conduct ongoing webinars and fast track groups. So we have several training opportunities for our nutrametrics consultants and for our health professionals on an ongoing weekly basis. So the first step is get to an NC training. Learn how to discuss nutrametrics with health professionals and with lay people, because you may also want to create a team of other nutrametrics consultants that can help you work with those health professionals. So you would learn how to approach both lay people and health professionals about the nutrametrics opportunity, and from there, your ongoing training will teach you what to do next.
You know, I'm looking at one of the questions here, and it's talking about a slow integration into a practice. And could I talk more about how we did that, or how we've been doing that, not just in my practice, but through thousands of health professionals across the United States? Because, again, one of the focuses or concerns with an account will be that it will take too much time to implement. And so really overcoming that obstacle by working with the practitioner in these terms, that our goal is to seamlessly integrate a wellness program into the practice without interfering with the hours that you or your staff currently keep. By doing what my nutrametrics consultant did, which is by helping me identify places in my office where there may be stagnation or choke points. You know, we spend a lot of time conversing with our patients about social endeavors, about movies, or weather or things like that. And these are opportunities that either the staff naturally has to ask questions or to take note of some of the needs of the patient. And one thing that across the board that we've noticed with patients is that they love the idea of their physician's office checking in with them. How are you doing? Are there things that we could do better for you? And so by changing some of these social conversations into customer service conversations, we're seamlessly or dovetailing nutrametrics, or a discussion about nutrametrics, wellness, weight management. What are you doing to stay healthy in between office visits without interfering with the amount of time that was naturally being spent with the patient? You know, utilizing certain types of campaigns in the practice, like wellness posters or questionnaires, but type of marketing type of solutions that open up the question to the patient is if there's something that they could do to reach optimal wellness. Would they look, what would they be willing to commit to? You know, these are some of the same types of marketing that preventative medicine campaigns are working on, pharmaceutical campaigns work through, which is just exposing patients to the question, are you as healthy as you want to be? And once that question is asked through marketing material or poster or some other type of solution in the practice that didn't require a lengthier office visit, the patients then in turn ask, should I be taking a vitamin D? Is there something else I could be doing to assist me with energy throughout the day? Are there alternatives to prescription medications if I don't qualify for a prescription medication? When the conversation is brought up by the patient, again, it turns into a natural dialogue from the physician or with the help of the staff or staff nurses to meet those patients' needs. I do recognize that time spent in implementation is a concern to any practice, especially a high volume practice. And so there are, and Brandi alluded to that when we discussed the nutrametrics consultant training on what those resources are and how to properly use them in the practice, or even identify which ones will be used or in what order to use them. But I will say this, it's a customized approach. Exactly. It's a conversation that you have with the practitioner about what they're looking to achieve, and you'll go as fast or as slow as their clinic makes available to you. Many practices will simply be happy by utilizing kind of a foundation approach, which is omega-3 fatty acids, a multivitamin, an antioxidant, maybe vitamin D, or a calcium or B vitamins, because these are products that are really well recognized as being foundational, supporting the needs of not just the patient but health outcomes with the practice. Instead of looking into what a physician may think is more esoteric type of solutions, like getting into digestive health, if they don't feel like that's their point of interest. You'll find many practitioners that want to really open up a discussion about a full line or full spectrum approach to health challenges. So this is very much a dialogue and a relationship that's built with the practice, and it's that relationship that will ultimately generate this rewarding wellness program within the facility.
And that's going back to, some of you might be thinking, well, how do I know what to say during this conversation with the practice? And that goes back to the nutraMetrix consultant training and the ongoing support that we provide, which leads me to two other questions that are related to that topic. One of the questions was, where do we find information on the nutraMetrix consultant training? Is it included in the NMTSS? The best place to go to find the information on the nutraMetrix trainings is to go to nutraMetrix.com. And when you go to nutraMetrix.com, there's a menu option across the top of the page that says Events. When you click on the Events tab, you will see the upcoming list of events of all of our trainings for 2013. They're not currently listed in the NMTSS calendar, but they are listed on the nutraMetrix page, which is nutraMetrix.com, under the Events tab. There's also a link for them on the MarketAmericaEvents.com page. A second question is, how do I know how to get past the gatekeeper or the staff member and get an appointment with a health professional? The question goes on to elaborate a little bit that this person is relatively young and they're afraid that the staff members won't take them seriously. And that's something, we've had a lot of people who look young, whether they're young or not, come to the NC training with that concern. And one of the things that we've told them is, when you go in with good, sound information and you can share with the health professional a business proposal of how they can generate significant revenue while helping improve patient outcomes, they start to look past what you look like and start to look at the information that you have. If you're still not comfortable with that, though, then what I would suggest you do is partner up with somebody who might be able to go with you on these appointments, and you work together. We teach how to use that, quote, that kind of buddy system in the nutraMetrix consultant training. Oftentimes if you're sitting as a patient in an exam room, not an exam room, in a waiting room of a health professional's office, you'll notice when the pharmaceutical reps come in or the medical sales equipment reps come in. And as they're coming in, they're often coming in as pairs. It's not uncommon for people to go out as pairs or partners to help approach the practice. But what we'll teach you at the NC training is how to put together a business proposal where you can show a practice that by simply working with patients who are already buying products from the other sources that we've mentioned, the health food stores, your Costco's of the world, your Sam's Clubs of the world, wherever they're going, patients are already spending money on nutraceuticals. And when you can point out to them that their patients are currently buying products from someone else, which, by the way, takes some of the control of the care away from the health professional when they're turning the patient over to somebody else to make their nutraceutical recommendations or their health recommendations, that practitioner is leaving money on the table. So if you're having a hard time getting to the health professional using the tips and techniques that we teach in the NC training, what you might want to try is to get to the office manager or the practice manager of the health professional, sit down with them, show them the type of money that's being left on the table that health professional is missing out on, review the proposal, the business proposal with them, and let that speak for itself. You can also we offer weekly prospecting webinars, which are really, they're more introduction webinars in nutraMetrix overviews. On the first and third Thursday of the month, we have them for nutraMetrix consultants, and the second and fourth Thursday of the month, we have them for health professionals. So you can invite your health professionals that you know to just simply listen in on a webinar and hear about how nutraMetrix has impacted practitioners like Dr. Mason and some of our other practitioners who have been very successful, and let this nutraMetrix program sell itself to your health professionals.
And that's done with the help of other successful physicians and other successful nutraMetrix consultants. So you know that what you're plugging into, or having the people that you work with plug into, is going to be well delivered and have really sound information, or the right kind of take-home message, because the people that are helping us really manifest this change in medicine today are very passionate about doing it, and that definitely comes through and can help you build that relationship we're speaking of.
So the final thoughts on this topic, because we're about out of time, the final thoughts are, we hope that this helped answer some of your questions about nutraMetrix and why we both personally chose to work with the nutraMetrix division. We have plenty of more opportunities to interact with you. You're going to be seeing more and more meet-on opportunities where we'll be doing these types of Q&As. You can always send emails to nutraMetrix@nutrametrix.com. You can visit us on Facebook at facebook.com/nutraMetrix. We look forward to interacting with you again on Meet-On, but thank you for joining us today.
Thank you.